The healthcare industry is on the brink of a massive transformation, and the smart money knows it. While everyone's been focused on AI chatbots and electric vehicles, institutional investors have been quietly positioning themselves in a sector that's about to explode: healthcare robotics. We're talking about surgical robots performing procedures with superhuman precision, automation systems handling hospital logistics, and rehabilitation robots helping patients recover faster than ever before. This isn't science fiction anymore. This is happening right now in hospitals around the world, and the three companies leading this revolution are set to become some of the most valuable healthcare stocks of the next decade. Stay with me for the next 5 minutes, because I'm going to break down exactly which three healthcare robotics stocks the smart money is buying, why this sector is poised for exponential growth, and how you can position yourself before the mainstream catches on. Let's start by understanding why healthcare robotics is such a compelling investment opportunity right now. The global healthcare system is facing a perfect storm of challenges: aging populations requiring more medical procedures, chronic shortages of skilled surgeons and healthcare workers, rising costs that are unsustainable, and increasing demand for better patient outcomes. Healthcare robotics solves all of these problems simultaneously. Surgical robots allow one skilled surgeon to perform more procedures with better outcomes and faster recovery times. Automation robots handle tasks like medication dispensing and supply management, freeing up nurses and staff for patient care. Rehabilitation robots provide consistent, tireless therapy that human therapists simply cannot match in terms of volume and precision. The market for healthcare robotics is projected to grow from around $15 billion today to over $50 billion by 2030, which represents a compound annual growth rate of well over 20%. When you find markets growing that fast, with clear problems being solved and real revenue being generated, you found investment gold. Our first stock is the absolute dominant player in surgical robotics. And if you've had surgery in the last decade, there's a good chance this company's technology was involved. This is the company that pioneered robotic-assisted surgery and still commands over 70% market share in the space. What makes this investment compelling is not just their current dominance, it's the razor and blades business model they have built. They sell the robotic systems to hospitals for over $1 million each, but the real money comes from the instruments and accessories that need to be replaced after every procedure, plus the service contracts and training programs. This creates incredibly predictable recurring revenue that grows as their installed base expands. Even better, once a hospital invests in their platform and trains their surgical staff on it, the switching costs are enormous. You're not going to retrain your entire surgical department and buy a new $1 million system just to save a few percentage points. The company has been expanding beyond their original urology and gynecology focus into more procedures: colorectal, thoracic, and they're pushing hard into general soft tissue surgery, which is an enormous market. Smart money has been accumulating this stock because they see the installed base growing, procedure volumes increasing, and international expansion still in early stages. The company recently achieved profitability on a sustained basis, which removes a major overhang that had kept some institutional investors on the sidelines. The second stock represents a different angle on healthcare robotics. They're focused on rehabilitation and recovery robots that help patients regain mobility after strokes, spinal cord injuries, and other conditions affecting movement. This is a market that's been completely underserved because traditional physical therapy is labor-intensive, expensive, and limited by the availability of trained therapists. Their robotic systems allow patients to get more therapy sessions with consistent quality, while the devices collect data that helps therapists optimize treatment plans. Here's what makes this particularly exciting. We're seeing a shift in how healthcare gets reimbursed, moving from fee-for-service to outcomes-based models. When hospitals and insurers are paying based on patient outcomes rather than just procedures performed, suddenly technologies that improve recovery times and reduce readmissions become incredibly valuable. This company's systems demonstrably improve patient outcomes, which means they're solving a problem that payers are willing to spend money on. The smart money is positioning in this stock because it's still relatively small, market cap under $5 billion, which means there's significant room for growth as adoption accelerates. They're also expanding from just rehabilitation centers into home-based devices, which opens up an even larger addressable market. Insurance coverage for their devices is expanding, which removes a major barrier to adoption, and their recent partnerships with major hospital systems suggest they're moving from niche player to mainstream adoption. Our third stock takes a completely different approach. They're automating hospital operations and pharmacy workflows. Think about how hospitals currently work. Nurses spend enormous amounts of time on non-patient care tasks, like retrieving medications, managing supplies, transporting materials. It's inefficient, and it contributes to burnout in an industry already facing severe staffing shortages. This company builds automated systems that handle medication dispensing, supply chain management, and hospital logistics. Their systems integrate with hospital IT infrastructure and use robotics to automate repetitive tasks that don't require human judgment. The investment thesis here is based on labor economics. As healthcare worker wages rise and shortages intensify, the return on investment for automation becomes increasingly compelling. Hospitals that implement their systems see measurable reductions in medication errors, improved staff satisfaction, and better resource utilization. The company has a subscription-based revenue model where hospitals pay ongoing fees for software, maintenance, and upgrades, which creates that beautiful recurring revenue that investors love. What's particularly interesting is their recent expansion into data analytics. They're not just automating tasks, they're collecting data that helps hospitals optimize operations. Smart money is attracted to this stock because it's less dependent on any single product cycle, it has multiple revenue streams, and it's benefiting from secular trends that aren't going away. Rising labor costs and increasing focus on operational efficiency in healthcare. Now let's talk about why the timing is right for these investments. We're seeing several catalysts converging that make 2026 potentially a breakout year for healthcare robotics. First, hospitals are finally recovering from the financial strain of COVID and are resuming capital equipment purchases that were delayed. Second, the latest generation of robotic systems are significantly more capable than previous versions. Better AI integration, improved user interfaces, expanded capabilities, which drives replacement cycles and new adoptions. Third, regulatory pathways are becoming clearer as the FDA and other agencies develop frameworks specifically for robotic medical devices, which reduces uncertainty for both companies and hospitals. Fourth, reimbursement is improving as insurers recognize the value proposition and create specific codes for robotically assisted procedures. When you combine product improvements, regulatory clarity, and payment mechanisms all aligning, you create the conditions for rapid market expansion. The risk factors deserve honest discussion because no investment is without downsides. Healthcare robotics companies typically require massive R&D spending and long development cycles, which means they can burn through cash before reaching sustained profitability. Regulatory approval processes can be unpredictable. A delayed FDA clearance or an unexpected safety issue can derail timelines and crater stock prices. Competition is intensifying as success in this space attracts well-funded new entrants, including major medical device companies and even tech giants exploring healthcare. Valuation can be stretched for high-growth companies, meaning if growth slows even slightly, multiple compression can hurt returns. And there's always implementation risk. Hospitals are complex organizations, and even great technology can face adoption challenges. If the workflow integration is not smooth, or if there's resistance from clinical staff. Here's what makes these three stocks particularly attractive despite the risks. They are all past the pure R&D phase and generating real revenue from products in actual clinical use. They each have some form of competitive advantage, whether it's market share dominance, proprietary technology, or network effects from their installed base. They're addressing real problems that healthcare systems are willing to pay to solve, not selling optional nice-to-haves, and they're benefiting from multiple secular trends: aging demographics, labor shortages, value-based care, and technological advancement that should provide tailwinds for years. If you're considering investing in these stocks, here's a smart approach. First, don't try to pick just one. Consider building a position across all three to get diversified exposure to different aspects of healthcare robotics. The surgical robotics leader gives you exposure to procedure growth, the rehab robotics company gives you exposure to outcomes-based care trends, and the hospital automation player gives you exposure to operational efficiency themes. Second, pay attention to their quarterly earnings and specifically look at metrics beyond just revenue procedure volumes for the surgical company, system placements and utilization rates for the rehab company, and recurring revenue growth for the automation company. These operating metrics often give you earlier signals about business momentum than financial results alone. Third, understand that these stocks can be volatile, especially around regulatory decisions, clinical study results, or earnings announcements, so consider building positions gradually rather than going all in at once. The smart money positioning in healthcare robotics is not speculative. It's based on fundamental analysis of market dynamics, competitive positioning, and growth trajectories. When you see major institutional investors and healthcare-focused funds building significant positions in these companies, they're not gambling. They have teams of analysts who've done deep due diligence, visited hospitals using the equipment, spoken with surgeons and administrators, modeled out the market opportunity, and concluded the risk-reward is compelling. You have the advantage of being able to see where they're positioning through 13F filings and ownership data, which gives you a roadmap to follow if you do your own confirming research. So here's your action plan. Research these three companies thoroughly by reading their latest annual reports and earnings transcripts. Understand their products, their markets, their competitive positioning, and their financial health. Look at analyst coverage to see what the consensus view is and whether you agree or disagree based on your own assessment. Check recent institutional ownership changes to confirm smart money is indeed accumulating. Then decide on appropriate position sizes based on your risk tolerance and portfolio objectives. Healthcare robotics stocks should probably be part of a growth-oriented portfolio rather than your entire portfolio. But for investors with multi-year time horizons who can handle volatility, this sector offers compelling potential for significant outperformance. The robotics revolution in healthcare is happening right now. The market opportunity is enormous, and these three companies are the leaders positioned to capture the lion's share of that opportunity over the next 5 to 10 years. Sonnet 4.5 Claude is AI, a